The coronavirus pandemic has claimed lives here in Wisconsin. I'm Adrienne Pedersen, today on Upfront. What worries medical professionals? And what about Wisconsin hospitals? Are they ready? Plus, the pandemic and the polls. Can voting for the spring election still happen, or should the election be delayed? I'll also talk to Milwaukee's mayor about being in self-quarantine and running a city in crisis from his home.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Thank you for joining us. The novel coronavirus outbreak is changing our lives in ways that we couldn't even imagine just 2 weeks ago. Wisconsin remains under a state and national emergency, and we now have seen the first coronavirus deaths in our state. Schools are closed, offices too, bars and restaurants closed, gyms closed. People are left without jobs, and we're all just trying to keep our social distance. That includes Milwaukee's mayor, who is self-quarantined at home after his own exposure to the coronavirus. The mayor is joining us via Skype from his home right now. So, Mayor, how are you feeling?
I'm feeling great. I'm here on Milwaukee's beautiful west side, and I've got a lot of time to spend here, but I'm still working around the clock from home.
And did you get tested for coronavirus?
No, I did not get tested. I have someone who works on my staff who tested positive. I have not had a fever. I don't show any of the symptoms. And unfortunately, this is one of the huge public policy issues. I'm not one of those people who is entitled, I guess would be the best word, to be tested right now. And I think that's one of the problems that we're facing as a nation, as a state, and certainly as a community, that there are not enough testing. There's not enough testing equipment. There's not enough personal protection equipment. And if you look at countries like South Korea that have been more successful, they got ahead of this. And then you look at countries like Italy, that's the challenge that this nation and certainly our community is facing right now.
And so many people are working from home right now, but in your case, this is a little bit different because you're trying to run a city that's really in crisis right now from your house. What are the challenges that will be going along with that?
Well, as we talked about a little earlier, some of them are the technology challenges. And I've learned more about computers and technology than I have in my lifetime because we've had cabinet meetings, we've had meetings with our EOC, I've had other meetings, and they've all taken place either over Skype or Zoom or conference calls. So again, I haven't slowed down at all. It's just a different type of communication. And I think around the nation, this is what people who are working from home are experiencing right now.
How confident are you in being able to handle everything that's going on with coronavirus when you can't leave your house?
I'm amazingly confident because in some ways there are fewer distractions, quite honestly, and I'm able to reach out to people, and I've had no problem. I've talked to members of the Common Council this morning. I've been in contact with the sheriff. Over the last couple of days, I've talked to the governor. I've talked to Senator Baldwin. I've talked to Congresswoman Moore earlier today. And so I've had many conversations, many meetings, checking in with people, making sure that all the vital city services are still in place, and that's what we're going to continue to do. So from the police department to the fire department to garbage pickup, we're trying to do everything we can to make sure that those core city functions are still operating. At the same time, my strongest message to people is, please, you're safer at home.
What does a shelter-in-place or a stay-at-home order look like?
Well, it would certainly allow people to go get their essentials, like getting their groceries and things like that. But it really, I think, rather than being caught up on the terminology, it should be what the concept is. And the concept is that you self-quarantine, and it's pretty fundamental stuff. The fewer people that you have person-to-person contact with, the less likely you are to contract the disease. And so what we're trying to do, and I think everyone recognizes this right now, if this comes as a tidal wave, our health system is going to be overwhelmed. From hospital beds to the equipment that the healthcare workers need, it's just not going to be there. And so we have an obligation. And I think some people say, well, I'm Superman or I'm Superwoman, I'm going to go outside. It's not just about you. It's about everybody else because you may be a carrier. And so for me, this is a time when community matters in a huge way. And you might feel great, but help everybody else, and let's just be safer at home. That's what I'm asking people to do.
The coronavirus is now deadly in Milwaukee, sad to say. What are you hearing from health officials in terms of how those numbers could grow in your city?
Well, we've seen how they've grown dramatically just in the last 10 days, and they're going to continue to grow. And the question is the slope of the line going to be as severe as it was in Italy, or is it going to taper off like it did in South Korea? And I think the best chance that we have to have it taper off like South Korea involves three things. One is done at the individual level, and that is to, again, be home, be safer at home. That's what we can do as citizens. That's what we can do. If this is a time situation, the President of the United States has to do a lot more, quite honestly, to make sure that we get the testing, because you look at what happened in South Korea, and the message over and over again was test, test, test. The second is making sure you've got personal protection equipment, because that's also very critical. But there's going to be a need, I believe, for more beds, and whether they're going to be hotel beds, whether they're going to be more hospital beds, that is something that is headed our direction in the next 2 weeks. But when you saw just several days ago, the governor of California predicting that over 25 million people in California, 56% of the state, would be affected by this, that's very sobering.
For people who are scared, what do you think Milwaukee might look like a week from now? Things are changing so quickly.
I think Milwaukee, again, you're going to see people on the street, and I think that's where we are right now, and that's where we should be right now, is fewer and fewer people on the street. To the extent that there are still businesses that are operating, I think you're going to see fewer businesses operating. Clearly, we have to have the essential businesses open, and that means primarily food and pharmaceuticals, making sure that people can get what they need. But we're going to be looking at other issues. We're going to be looking at issues for the homeless. What do we do with the homeless? And we've had conversations at the city level about that. How do we make sure that our fire department is able to respond? And one of the words of caution I have is that 911 is not the number you call to get diagnosed for this. 911 is emergency phone service. It's an emergency phone service for people who need medical care or have disasters or challenges like fires or crimes. So please don't use 911 for getting an analysis of the COVID virus. That's not the appropriate place for that.
And Mayor, I've heard some criticism about your response, saying that it's piecemeal, that different groups are operating in silos and not operating as a whole, and that you should have gotten out more ahead of this. What's your response?
My response is that's politics, and I'm a big boy and I understand politics. Frankly, I was out sooner than just about anybody else on the local level, but I don't have time for politics right now, with all due respect. This is about dealing with a crisis that we have right now. I'm going to do everything I can to help our community navigate through this.
Mayor, we appreciate your time, and we hope that you continue to feel no symptoms while you're in there for that 14-day quarantine. Thank you.
Thank you.
Next, the pandemic and Wisconsin hospitals. Are they ready? And later, what to do about that rapidly approaching April 7th election. There's a partisan split about going forward.